Welcome to Medical Ward BSN 3E Group 2, third rotation NCM 116 RLE, Nursing Care Management 116 RLE, Medical Surgical Nursing 2, Virtual Clinical Duty. This is our first week, and of course, our focus for today is case scenario of patient CD diagnosed with primary insufficiency. But before that, please allow me to share this premise with you. I am here for you. It's literally my life's work to help you grow. And also, please allow me to share our learning outcomes for this week. On completion of this case study, student nurses will be able to first, build knowledge related to the patient's medical experience. Second, continue to develop a comprehensive assessment and monitoring skills. Third, recommend nursing interventions based on the case presented. Fourth, define the roles and the contributions of student nurses in the care of medical patients. And fifth, justify optimal therapy based on the current understanding of the case. So this will be our expected outcomes at the end of our case analysis for this first week. And also, please be reminded of the following instructions. All critical thinking questions presented within or after the case applies to this case study. You have to create a brief and to the point responses, no flowery words. When asked to provide several answers, it must be listed in order of priority or level of significance. Base all your answers on the data that is presented and do not assume information that is not provided in the case. Further, please follow the format of your output, especially on its font style, font size, paper margin, and paper size. So I've given you the format already or the templates of your daily and weekly requirements. Please follow that. Save it as PDF file and submit all your requirements per group on date specified as its deadline. Of course, I will not be accepting any Word file. You have to convert your Word file into PDF file, and of course, that will be submitted before the set deadline. Send all your requirements via the official email address of your clinical instructor. I'll be giving you my email address at the end of this presentation. It is advised that you will submit all your requirements on or before the set deadline of submission. So, of course, in order for you not to get deduction of your score, please submit your requirements before the set deadline. Furthermore, kindly follow this format in saving your requirements for easier monitoring. For daily requirements, example includes Abang underscore Joseph underscore W1D1 underscore NCM 116 early for day 1. Another one is Abang underscore Joseph underscore W1D2 underscore NCM 116 early for day 2. And for weekly requirements, example is Abang underscore Joseph underscore W1 underscore NCM 116 early for week 1. Let's now have your case scenario of patient CD diagnosed with primary insufficiency. Case history. Patient CD is a 20-year-old male, college student, and is currently enrolled in one of the universities in Cagayan de Oro City. He is residing in an apartment near the school where he is currently enrolled at. He came to the ER of MRXUH for his immunodeficiency problem. At the ER, he gives you a letter from his attending physician, hands you a vial of gamma globulin, and asks you to give him his shot. The letter from patient CD's physician states that he was diagnosed with primary insufficiency disease 18 years ago. He has an adequate number of B cells, but they fail to mature properly and become plasma cells or immunoglobulin. Patient CD states he has a history of chronic respiratory and gastrointestinal infections. He is maintained on 0.66 ml per kilogram gamma globulin IM every 3 weeks and has tolerated this well. He has no known drug allergies. His vital signs are stable. He was admitted in the medical unit for just a day and was discharged thereafter. Patient CD's vital signs are as follows, taken during his visit in the hospital. Blood pressure of 110 over 85 millimeters mercury, pulse of 90 beats per minute, respiratory rate of 18 breaths per minute, temperature of 37.5 degrees Celsius. Patient CD returns in 3 weeks with complaints of a stuffy nose. He is also due for his next injection of gamma globulin. You attended his needs and were able to give reinforcement about teachings that will benefit him and reduces the risk of getting infection. Let's now have your high 5 critical thinking questions. Number 1. Compare how primary immunodeficiencies differ from secondary immunodeficiencies. Again, compare how primary immunodeficiencies differ from secondary immunodeficiencies. Number 2. What is the most common primary immunodeficiency? Again, what is the most common primary immunodeficiency? Number 3. Explain why patient CD is at greater risk for developing infections than his classmates. Again, explain why patient CD is at greater risk for developing infections than his classmates. Number 4, before patient CD leaves, you assess his knowledge and give specific precautions. What will you assess and what precautions will you give? Again, before patient CD leaves, you assess his knowledge and give specific precautions. What will you assess and what precautions will you give? Last number 5. If patient CD is developing a sinus infection, what signs are you likely to encounter on examining him? Again, if patient CD is developing a sinus infection, what signs are you likely to encounter on examining him? Let's now have your daily requirements. For day 0 Sunday case scenario loading, for day 1 Monday, your basic requirements includes GO, SO, DPA, Series 1, Nurses Notes 1, or the FDAR 1. And also you have to have an initial knowledge about the case that includes your physical assessment, pathophysiology, diagnostic test, and also the drug study. For day 2 Tuesday, our basic requirements includes your SO, DPA, Series 2, Nurses Notes, FDAR 2, weekly evaluation, reflective journal reading, critical thinking answers, and of course, you have to have your initial knowledge about the case that includes your problem list, nursing care plan, discharge plan. For weekly requirements, these are the flow of your week requirements, and I think that is actually stated in your format for the weekly requirements, and that includes your introduction, nursing health history, physical assessment, anatomy and physiology, pathophysiology, diagnostic tests, drug study, problem list, nursing care plan, discharge plan, learning outcomes, and of course your references that utilizes the APA style of reference taking. The deadline of submission for day 1, deadline is March 22, 2021, Monday, 11:59 p.m. For day 2, March 23, 2021, Tuesday, that's 11:59 p.m. And for week 1 requirements, the deadline is March 27, 2021, that's Saturday, 11:59 p.m. We are all on our own journey, but in this class, we all need one another and will help one another grow. These are my contact details. My email address is jabang@xu.edu.ph. My personal number is 0931-042-9842, and of course my social media accounts. This has been Joseph Bahian Abang at your service to make your best even better. To God be all the glory.